If you are contemplating any nasal cosmetic surgery or rhinoplasty, there are few factors which are to be kept in mind while deciding the final shape. First thing is whether there is any medical reason or not. Now the medical reason is there, you cannot breathe properly from one side or another side of the nose, so we definitely know that maybe there is some septal deformities there or some terminates are there. So while doing the rhinoplasty, we have to correct that so that the passage is very clear. If a septum is straight, your nose will be straight. If septum is crooked, your nose will be also crooked. So that is one thing we always keep in mind. That is the medical or functional causes for that. Second is the facial harmony. Your nose should be in harmony with your face. That is very important. If you have got a broader face, so then even the broad nose will go okay with that. Now if you have got broader and we give it a very narrow shape, so it will not be harmonious with your face. Similarly, if your chin is behind the line which is drawn from frontonasal to anterior nasal spine and chin, they should be in one line. If they are not in one line, so it means they are not in a harmonious position. So either the chin has to be augmented or the nasal height has to be reduced a bit so that it becomes more harmonious. But for that we have to do some x-rays also, and then we know whether we have to augment the chin or not. If face is very thin, then it will go well with the thinner nose, so we have to narrow it down also. We have to cut the bones, make it narrow, and maybe slightly give you a sharper tip. If you are male or female, then also there is some difference, because male have usually got thicker skin and you may not get a very sharp tip like we can give it in females, because the female skin is thin. So whatever changes you are making, it's like a curtain. So if a curtain is thick, what is behind the curtain you can't see, but if the curtain is thin, whatever is behind you can see. So same thing, if we make any changes in the tip of a female, because her skin is thin, you can see the changes, you can appreciate it better. In men, you may not be able to appreciate that much. So these are the limitations also. And third factor is personal preferences. So if you got any personal preferences that you want slight hump to be removed or slight height to be increased, so these are personal preferences also. So these are basically three components which we always keep in mind before planning your rhinoplasty. That is there any medical problem? Is your nose in harmony with your facial structures? And then what are your personal preferences? So these things we look at it, and then we decide a shape for you, and accordingly we proceed.